Hello, psychology students. This is Mrs. Politsky, and I have notes for Module 1, Psychology. So let's begin. What is psychology? Well, psychology is the scientific study of the behavior and mental processes. Now, there could be longer definitions. As a matter of fact, if you look at your definitions from your textbook, you're going to find something a little more wordier than this. But this, in its essence, is really what psychology is all about. We're looking at how a person acts and how they process and what they're thinking about. Okay, if we break the term psychology down, we can look at the terms of psych and logos. And if you remember a little bit about maybe some of your studies in Mrs. Swanson's class in the sciences, you know that logos means study of. In this case, psych means the mind. So the question is, what is psychology not? And psychology is not things like common sense or advice or talk shows, or, you know, if even if you wanted to get into the things that are a little more questionable even with our faith, this concept of astrology and fortune tellers and people who read palms, all of that is what we would call pseudo-psychology, which is the false psychology. Careers in psychology. As we go along here, and especially when we get into our next series of notes, you're going to hear a little bit more about fields of psychology. But in general, psychology is one of the most popular college majors. So it is the second most popular college major. There are more than 70,000 college students who graduate with some form of degree in psychology, meaning they major in it or maybe they have a minor in psychology. Psychology can be applied to a lot of different occupations, and we'll get into that maybe in our next series of notes. Counseling versus clinical psychology. Counseling, for the most part, deals with problems, for the most part, of everyday life, living, adjustments to stress, marriage, divorce. When we talk about people who are preparing for marriage, a lot of times you will meet with a priest or a deacon. In the process of that, you might do an inventory called the focus. And some of that is to kind of get couples to start talking about, you know, what it is that they truly hold as important in their lives. And really what that's all about is counseling. Okay, clinical psychology is a step further. It deals with serious problems. We could be talking about mental illness. We could talk about issues that are a little bit heavier than just talking about normal everyday functioning. A lot of times clinical psychologists are going to use their skills. They have been trained in how to run therapy groups. They have been trained in how to assess or research individuals. Many of them have backgrounds in health. Some of them have a background where they do private practice. Some of them work in the public sector. So it can cover a really wide variety of different skill sets. Psychologist versus psychiatrist. And this is one issue that, you know, a lot of psychology classes talk about kind of in the first day or so of taking an intro class, and is to kind of help you understand maybe the differences here. Psychologists, for the most part, are individuals who have received a doctorate in philosophy. That's what a PhD is. It takes them roughly 3 to 5 years after they have obtained a bachelor's degree to get through probably the master level, along with the doctoral level as well. And so they're doing a lot of work in theory, a lot of research. They learn about methodology as far as how to conduct research. They might go into learning how to diagnose, and they learn a lot about how to sit down and to use different types of therapy methods. Many individuals who major in psychology and go the distance to become a doctorate candidate also do an internship, and many of them last about a year, and they might be in conjunction with a hospital or some kind of mental health organization. A psychiatrist is a little different. They are a medical doctor, no different than maybe your family physician. These are individuals when they finish their bachelor's degree, they apply to go to medical school. And so they go through all the same kind of training as a medical doctor would. As a matter of fact, one of the rotations for most um, medical doctor candidates is to do a series within psychiatry so that they kind of have an understanding of what that's all about. One of the things that psychiatrists can do that maybe psychologists can't do is the prescription of medicines. Okay, because they have that kind of understanding of the physiology and the anatomy of individuals. They have more abilities to prescribe the correct meds for an individual. They also look for primarily physical causes for why individuals are acting unusual or have um, some type of problem. And so a lot of times they're looking at the biochemical side of an individual. Is a person experiencing a hormonal imbalance? Is there a structural problem with maybe the brain or the nervous system? And this takes a little bit more training than maybe those individuals who are just majoring in psychology. All right. Thank you very much.